Hi there, it's Tammy here. And in this short video, I'm going to talk about why I believe there's a disconnect between getting clearance to exercise and actually exercising during pregnancy, which is why I believe so many women fall into the void of either, doing things like going it alone or continuing to do what you've always done without understanding the potential cost versus the short-term benefit of doing this. You might turn to Dr. Google or follow a pregnant fitfluencer or even downgrade your training to just walking, swimming, or following free generic one-size-fits-all options that you find online. Now, as a pregnancy and postnatal specialist strength coach with over a decade's experience training pregnant and postnatal women, I genuinely believe that there is a better way. So if you want to ensure that your health and well-being journey during pregnancy doesn't fall into this void, into this disconnect, then this video is absolutely for you. And a big reason why I believe that there is this disconnect is because I genuinely think that clearance from your healthcare provider, while extremely important, is actually incomplete, right? It's actually the bare minimum. And I don't believe it's supporting pregnant women the way that they genuinely deserve to be supported throughout their pregnancy journey. But it's important to understand that we can't blame healthcare providers for this. And in no way, shape, or form am I doing this, not at all, right? But the reality is you only see your healthcare provider for a limited amount of time at your scheduled visits, which, if you're lucky, would be every, say, 4 weeks from 12 to 28 weeks, and then increasing in frequency as you get closer to your birth. And then, of course, within these visits, there is such a vast amount of information specific to you and your baby's immediate health and well-being that, of course, your healthcare provider absolutely needs to prioritize the information that they're delivering. And a lot of the time, exercise, nutrition, and mindset is kind of low on the priority list, right? And studies have even shown that time constraints are the biggest barrier preventing healthcare providers from discussing things like exercise with their pregnant patients. And it's quite possible that the vast amount of information that needs to be covered when discussing exercise during pregnancy just adds to that kind of lack of time feeling. And I'm sure that this lack of time feeling is actually part of the reason why the research into this area shows that information given by healthcare providers around pregnancy exercise is often incomplete or inconsistent, right? From my perspective, there are actually so many interconnected aspects of health and well-being and training during pregnancy that I think the question that we should be asking is, why is this falling onto the healthcare provider's shoulders in the first place? Of course, they should be giving you clearance to exercise. That is really, really important. But why is guidance on this then being left to them as well? They are healthcare providers, they are obstetricians, they are midwives, they are doctors, they specialize in safely delivering your baby. They are not pregnancy and postnatal specialist strength coaches. They don't specialize in safe exercise prescription during pregnancy. And just to put this into perspective for you, I have a question for you, right? Would you want me, a pregnancy and postnatal specialist strength coach, delivering your baby? Probably not, right? I don't think I'd even want to either. Now, no doubt, you'd probably actually really prefer your healthcare provider, who, depending on their qualifications, has likely spent up to 12 years studying to become specialized in their field. You'd want them delivering your baby, right? Of course. Now, let's flip that around. Would you want your healthcare provider who specializes in delivering babies to program your training during pregnancy? Or would you want someone like me who spent over a decade providing individualized exercise prescription to pregnant and postnatal women, training you and delivering your strength training programs? Probably, right? Now, because your healthcare provider doesn't typically deal with this aspect of your health and well-being during pregnancy, it actually comes as no surprise to me that the research shows healthcare providers actually feel inadequately trained in prenatal counseling on things like weight gain, nutrition, and exercise, and that they feel unconfident in discussing these topics with their patients. And let's be real here, right? These topics are vast. They can change with the different stages of your pregnancy. Hell, they can change week to week, day to day, and even month to month, trimester to trimester, absolutely. And the reality is these topics take time to navigate, time that we already know that your healthcare provider just doesn't have. Now, another possible reason for this lack of counselling is that healthcare providers actually perceive weight and weight gain as sensitive and emotional topics, right? And they may fear that their patients are offended or embarrassed by discussing them. And of course, I certainly understand that these can be sensitive topics. And it's probably more accurate to say that they haven't actually had time to build the relationship equity with you, with their pregnant patients, to be able to discuss such sensitive topics. So again, it comes back to time. So there's not only a lack of time feeling, but healthcare providers are also feeling inadequately trained in prenatal counselling on things like weight gain, nutrition, and exercise. And it's likely that these are the reasons why we're seeing studies showing things like the majority of doctors, like 57%, either never, rarely, or only sometimes recommend that their sedentary pregnant patients with no contraindications begin exercising, right? And I've spoken about the increased risks that come with being sedentary during pregnancy. So you can see why this theme is extremely, extremely concerning for me, being a strength coach, right? And we also genuinely want sedentary women who do not have any medical contraindications to exercise during pregnancy. It's really important. And a study of overweight and obese pregnant women sadly also revealed similar themes. These studies found that most overweight and obese pregnant women actually received limited or no advice on appropriate physical activity during their pregnancies, and that those who did receive advice were told not to exercise more intensely than before they were pregnant, right? Now, the problem with this advice is that since many of these women were sedentary pre-pregnancy, they took this to mean that they should continue to not exercise during their pregnancy. And of course, I've spoken about the risks that high pre-pregnancy BMI or body mass index and excessive gestational weight gain are actually associated with. And based on these studies alone, we know that the advice being given to sedentary women and women with high pre-pregnancy BMI is incomplete. These women are falling into the disconnect, into the void, when what they genuinely need is connection and support around their health and well-being throughout their entire pregnancy journey. But what about the advice being given to women who don't fall into these categories, right? The women who exercise regularly or, they exercise somewhat regularly. I believe, honestly, that there's a disconnect here as well. Now, before I go into these, please remember again that we can't blame the healthcare providers for this. And in no way, shape, or form am I doing this. But the reality is that the studies show 24% of healthcare providers are rarely or never advising their patients to strength train. As a pregnancy and postnatal specialist strength coach, this is especially concerning for me. But what about the fact that 24% of healthcare providers do not discuss exercise during pregnancy with most 75 to 80% of their patients, or that 57% do not recommend sedentary, healthy pregnant women begin exercising while pregnant, or 54% recommend exercise limitations based on maximum heart rate, or that 54% recommend decreased exercise in the third trimester. And it's extremely important to note here that the recommendations regarding, the sedentary pregnant patients, resistance training, maximum heart rate, and a decrease in third trimester exercise, sadly, all of these contradict ACOG's guidelines based on when the research of those statistics were done, of course. So this is probably a good time to talk about what the ACOG guidelines actually are and the ACOG's recommendations. So the ACOG recommendations are that, things like physical activity and exercise in pregnancy are associated with minimal risks and have been shown to benefit most women. Although some modification to exercise routines may be necessary, of course, based on, the normal anatomic and physiologic changes and, of course, the baby's requirements. A thorough clinical evaluation should be conducted before recommending an exercise program to ensure that a patient does not have any medical reason to avoid exercising, and that is very important. And that women with uncomplicated pregnancies should be encouraged to engage in aerobic and strength and conditioning exercises before, during, and after pregnancy. That gives a double thumbs up from me. And that obstetricians and gynecologists and other obstetric care providers should evaluate women with medical or obstetric complications carefully before making recommendations on physical activity and participation in it during their pregnancy. And that activity restriction should not be prescribed routinely as a treatment to reduce preterm birth. That's really important. But now that you know the recommendations, you can see why I believe that there is a disconnect, why this pathway is actually inadequate or incomplete. And a huge one for me, of course, is that 24% of healthcare providers rarely or never recommend strength training to their pregnant patients. There is no disputing the far-reaching benefits of strength training during pregnancy. I've based my entire career on this, so you can see why that's concerning for me. But I think the biggest question of all for me is why clearance from your healthcare provider is actually the base requirement for participation in so many exercise options, or the only requirement, for so many options for the pregnant women to exercise. Sure, it's necessary, but should it really be the only requirement for your participation? I don't think so. Especially given the interconnectedness of the various health factors during pregnancy. I genuinely think during pregnancy, women need to be supported across the 4 core pillars of health, being education, mindset, nutrition, and of course, training, right? And when it comes to training, I actually genuinely believe that training during pregnancy needs to consider things like the person's training age, their training experience, their exercise history, and their injury history. Not just, hey, have you got clearance to exercise? Great, off you go. The thing is that pregnancy is a fantastic time to modify your training to work on things like muscular imbalances. But more importantly, you want to make sure that you're training in a way that minimizes the physical impacts of pregnancy on your body, including your abdominals and your pelvic floor. And that pregnancy is also an amazing time to start implementing long-term changes to your health and well-being practices. And these, of course, have the potential to positively impact your entire family over the long term, not just during pregnancy. And it's for all of these reasons you can see why I believe that clearance to exercise during pregnancy is the bare minimum, and why I believe that there's actually a disconnect between this and what the pregnant population, what you genuinely deserve when it comes to your health and well-being journey during pregnancy. And of course, this is why I created the Pregnancy Process Program, a simple online process developed to support your health and well-being throughout your entire pregnancy journey. A place that you can turn to for education and information across the 4 core pillars of health that includes things like connection and support with a specialist, community and connection with other women all experiencing similar journeys, as well as individualized strength training programs tailored to your training age and your training level. Because I genuinely believe this is what's needed to connect clearance to exercise with a pregnancy health and well-being journey where you feel safe and supported throughout the entire journey. And of course, if you want to know more, feel free to head to the link in my bio or the video description and apply to join my complimentary but private community. So that's it from me today. I hope this video helped, and I'll see you in the next one.